Hi, and welcome back to The Honest Nurse. I got so much really nice feedback from my first video, I cannot tell you, and I'm so honored that y'all want to hear what I have to say. So thanks for visiting us again today. We're just going to charge right in, and I want to ask you a question first of all, and that is, how many of your nursing friends are looking for a way out of nursing? This is a serious topic, but just for fun, I was going to give you a list of what some of my nursing colleagues would rather do than be a nurse in the current situation. Now, one wants to cut fabric at the Hobby Lobby. Nothing wrong with that. One wants to tend bar on the beach. Well, that sounds like kind of a cool job. One right here wants to drive an 18-wheeler, and I'll take it anywhere. I don't really care. Another one wants to work at the deli at the Publix store, because I guess they really have good sandwiches there, is what I've heard. And another friend just wants to learn how to use a scanner. She doesn't care where, just wants to use a scanner on anything. And I'm sure that you viewers can come up with a list of your own, but the point is, how truly sad is it that accomplished nurses who should be valued and protected as they care for their patients would rather seek employment as far away from patient care as possible? So for years now, hospitals and other healthcare settings that employ nurses have been looking for ways to treat nurse burnout with wellness programs. And many of you are familiar with these. And now most of the out-of-the-box wellness programs are usually composed of some type of combination of exercise, meditation, diet improvement, mindful breathing, yoga, counseling, employee assistance programs, etc. And to be clear, I'm not condemning any one of those practices or programs. They all have extreme value in the right set of circumstances. But let's look at the issue of taking care of nurses realistically and meeting them where they are in the workplace. Okay, now when I finish my 14-hour shift on my feet all day, the last thing I want to do is go walk on the treadmill at the wellness program. Or when I'm taking care of too many patients on the floor and rushing to meet their needs, does mindful breathing in the corner of their room really make that situation better? Or if I'm melting down from too many admissions in the ER on a Saturday night, do I call a counselor at midnight? Can I find peace and tranquility even for a few seconds in the break room? And let's go down that rabbit hole right now. Have you ever noticed that the break rooms for nurses are always the smallest, most congested room on the unit? It's clear that nurses' comfort and well-being is not really a priority. Now, wellness programs can be fine when you can use the program. But those of us who are working use our free time to catch up on the things that can't get done because we're working. Here are a few examples of some other activities that wellness programs that I've looked at suggest that we try. First would be a walking challenge. I've already talked about how I feel about the walking, right? The second is compile an employee cookbook, which is not a bad idea in and of itself, probably kind of sort of fun. How does that help you when you're on the unit? I don't think it really helps. Third thing is here, start a gratitude challenge where nurses are asked to write down 3 things that they are grateful for each day for 3 weeks. Are you kidding me now? Are you kidding me now? Last thing here I see is participate in a community event. Well, most of the people that are working nurses are using their free time to take care of their families, to go to their kids' sports events, to take their family somewhere where it's fun to be for the day. Maybe that is a community event. It depends on the event, I guess. So you can see, there is a culture in healthcare leadership that professes to speak on behalf of workers without actually providing what we need. And here's a news flash. But regardless, administrators can and do pat themselves on the back when they institute a wellness program, thinking that this will fix the problem. And these programs are not cheap. Just think how much a few $1,000s spent on a kumbaya session could be used on a solution that really works. Now, I find this really ironic because in nursing practice, we all do some version of the SOAP process. I probably am dating myself when I talk about SOAP charting, but the whole idea is we identify a problem, we write down objective observations, and we collect data, and then we devise a plan of action. And then we go back to evaluate if the plan was carried out and did it work to address the problem. But I cannot seem to find any measurable proof that wellness programs work. Did anybody ever evaluate them? And what kinds of metrics did they use to measure them? Is there ever any deep dive into their value? Or is it just a feel-good thing? So what does work? Okay, well, I'm wondering if you noticed that all the suggestions that I mentioned before involve activities that you do for yourself. There's no mention of changing the system itself to better meet a nurse's needs. Now, is that the way it has to be? Can the system not look honestly at itself and see what changes can be made at the grassroots level? Oh, and has any administrator acknowledged that the stress caused by unstable hospital situations through mergers and acquisitions are a huge source of emotional turmoil? Well, here at The Honest Nurse, I think we've reached a critical tipping point where the system has to change. So here are some thoughts for administrators. Okay? When a nurse, has too many patients, hire more staff and pay them well. You see? It's not rocket science. And at a time when hospital CEO salaries are skyrocketing, I do not want to hear about budget constraints. When hospitals got rid of support staff like ward clerks, LPNs, respiratory therapists, nurses' aides, guess who got all those duties added to their workload? Here's another suggestion. Invest in machinery and equipment to help nurses move obese patients. Now, we all know that our population is getting more and more obese. It makes perfect sense for every healthcare facility to have some form of helping nurses move patients. There's a lot of different things out there that can help you. Hoya lift, inflatable transfer sheets, motorized stretchers, all of which are going to cost you a whole lot less than paying out disability for the rest of their lives on nurses' back injuries. Here's another suggestion. Make hospitals safer environments for the staff. Now, I'm going to go ahead and show you a clip right here of a story that just broke this weekend. So tragically, 2 nurses were murdered on the maternity ward where they work from gunshots. Are you telling me that a nurse cannot be safe at their workplace? Well, that's sure a detriment to anybody wanting to be in nursing, is it not? Now, here's the rub. You cannot carry a gun into a courtroom because you go through metal detection. You cannot carry a gun on the airplane because you go through TSA. You cannot carry a gun into the school because, rightfully so, they have got all kinds of barriers and ways to check people before they get into the schools. But you don't have to have any restriction about carrying a gun into a hospital? Well, here's a thought. Hire good, strong, able security people. They're going to have to screen people as they walk in. It is just not acceptable for nurses to have to risk being shot while they're at the workplace. And along those lines, kind of to dovetail into that same idea, is the fact that no nurse should be hurt by a patient. Now, back in the day, we used to have orderlies that would assist us with difficult and unruly patients. These were big, strapping men, and they were very helpful at the time. Well, we don't have those anymore. So we have to handle it ourselves. So my counsel to you is to say to the patient, who frequently will hit or kick or swat at you, spit on you, what have you, that behavior is not acceptable, right? We're not talking about children for the most part that can't understand what's going on or whatever. Lots of things happen to make people confused and upset when they're in the hospital setting. I'm talking about adults for the most part. Speak to them like adults. Do not say things like, it'll be okay, and you just have to hold still a little bit longer, and everything's gonna be fine. No. When somebody hurts you, when somebody goes to swing at you, to spit on you, your immediate response is that is not okay. That behavior is not tolerated. And that very stance needs to be supported by administrators. So that when a patient complains and says, oh, the nurse told me I couldn't do this, or the nurse told me I couldn't do that, the administrator says what? I stand by her or him. I support them, because that behavior is not allowed here. We protect our nurses in this facility. That'll get me on a real soapbox, as you can tell. Give nurses, as another thought, access to a place that's calm, that's comfortable, that's quiet, that smells good, that has low lighting, etc. Maybe where they can recline and put their feet up when they do get a chance to take a break. And I'm not talking about one big room for the whole hospital where you have to run down the stairs and then run back up the stairs because the elevator isn't working. I'm talking about one room, probably a patient room, on each floor that is a designated room for the nurse, right? A room where they can feel relaxed for just a short period of time. This is not going to cost a whole lot of money, right? But it's going to mean a whole lot to the nurse if they can get away privately, quietly, someplace comforting before they have to go back out onto the floor. Another idea is to support the nurse. Well, you know what? That's a pet peeve of mine, that support is kind of an overused term. And how do we ever measure that? Well, how do we demonstrate it? When a problem is identified, have an action plan. Just like in the nursing process, have an action plan to address it and have targeted, measurable solutions, okay? If a nurse has got too many patients, reduce his or her load with equitable assignments. If there's an obese patient to move, provide mechanical ways to help, not giving nurses back braces. If there's a process, a procedure, a new technique that the nurse is not familiar with, arrange a mentor to help teach the skill and pay it forward. How many times do we sacrifice our young nurses or otherwise inexperienced nurses on the night shift to fend for themselves with no mentors and then wonder why they fail? So my counsel to my nursing colleagues out there is to identify clearly what you need in the workplace while you're working that will ease the grind of your day. If you have a wellness program at your facility and you believe it's not working, then say so. And make an effort to say what does work for you with specific instructions and suggestions. That's it for today. Remember what we say here at The Honest Nurse. If you don't stand for something, you'll fall for anything. Thanks again for listening. If you like what I'm saying and you want to hear more, please like and subscribe.